There it is.
PA mobilization. So take your hands with your fingers going towards the ground and just in a loose curled position, just around the neck, kind of like the neck of a baby bird, nice and soft. And then what you're going to do is you're going to take your hands and you're going to go distally to run into the first rib. So then you're going to feel the front of that, and that's going to take you to T1. And then you're going to come over centrally, and that should be T1 spinal process there. So you can confirm that by coming proximally, and you should feel a drop off, and that's C7. And if you come one more, you can feel C6. Now you can confirm that C6 by having the patient extend their head. So go ahead and extend your head up and bring it back down. And if C6 moves, C6 will move, C7 will stay still. So that's how you can differentiate between 6 and 7. So now I know where 6, 7 is. So now I want to get all that tissue out of the way. So I'm going to burrow in underneath here with my thumbs. And I'm not on the C6, 7 facet, I'm on the back of the transverse process of 6. And then I'm going to take the MTP of my left index finger and I'm going to wrap that around onto the anterior part of this transverse process. Then I'm going to draw all the skin slack back this direction to get all the slack out of that. Then I'm going to burrow that back in and reinforce that with my other thumb. So I've got my skin lock pulling around on the anterior part of C6. I've got my thumb right on the back of C6, or you can slide it to C6, 7 facet joint if you want. Reinforced with my other thumb. Now you can mobilize from here, and you've got the contact on the anterior part of C6 transverse process and on the posterior part over near the facet. You can add another skin lock to it with my right hand, pulling that over from the anterior or as close to the anterior part of the transverse process as you can. You probably won't be able to get all the way anterior on that side, but just get a skin lock, pull that out, reinforce one thumb over the other, and then get your nose over the level that you're mobilizing, and then it's a 45-degree angle that you're trying to achieve towards the head to keep in the angle of the facet. So you can reinforce like so. You can also do adjacents if you want, and that will kind of save you a little bit. You have to have adequate extension of your eyepiece to do this. You can do it with less IP extension, but it's going to be a little bit more pokey, and you're going to use your flexor pollicis longus a little bit more. But you can do that, and to give yourself a little bit more strength in your flexor pollicis longus, you can get your thumbs opposite each other or directly opposed on each other for support. And then nose over your level. It's just like you're trying to move that C6 slice of bread in the loaf individually from the other slices. Right on C6, or you can go right on C6/7. All right, thank you.